Hi, everybody. My name is Abby Silfies, and I'm the Executive Director of the Lehigh Valley American Heart Association. And this is our very first episode of Conversations from the Red Couch, a new program that we'll be bringing to you quarterly in partnership between the American Heart Association of the Lehigh Valley and the Lehigh Valley Heart Institute. We're really excited for this community conversation, and especially today with our very first guest. My guest today is a friend of the American Heart Association, a member of our board, and a doctor with the Lehigh Valley Heart Institute. My dear friend, Dr. Amy Ahnert. Amy, would you like to tell everybody a little bit more about yourself?
Sure, Abby, thanks for having me. This is really exciting to have this virtual Red Couch conversation. So I am the director of the Women's Heart Program of the Lehigh Valley Heart Institute at the Cedar Crest campus. And I'm also the co-director of our cardio obstetrics program, which is a unique program that is a multidisciplinary program between cardiology and maternal fetal medicine.
Well, I want all those titles because you sound very esteemed, but we're so glad that you were able to make some time for us virtually today to sit on our red couch and to be able to share with the Lehigh Valley some vital information that we feel like, women in our community really need to know. So let's jump right in. You good?
Sounds great.
All right, Amy, so let's start with a simple question, but one that I believe is probably very important. What can women in our community do to reduce their risk of heart disease?
So it's a great question. And I think one of the most important things that women in our community need to know is that heart disease is preventable. So if you look at the statistics, greater than 80% of heart disease can be prevented. So the first and foremost thing that women need to do is to know that they can take control of their heart health with making very simple steps to living a heart healthy life. Number one is they need to know their risk factors. And I always say to women, you're never too old and you're never too young to take control of your heart health. So having a heart healthy checkup, knowing what your blood pressure is and what your blood pressure goals are, knowing your cholesterol, making sure you're being screened for diabetes or even pre-diabetes. Most importantly, having a healthy lifestyle with exercise and heart healthy eating. So those are two really important factors of prevention that women can really make changes that can have a great impact on reducing the risk of heart disease. So collaborating with a physician, knowing what your risk factors are, and doing everything that you can to live a heart healthy life. So not smoking, getting active, eating healthy, making sure your blood pressure and cholesterol are controlled, and those things can make a really big difference at preventing heart disease. It is not inevitable, and we can make a really big change at fighting this great epidemic.
It's amazing to me that things that sound so simple, right? Like get out and take a walk, eat right, don't smoke, are things that can prevent something that is such an astronomical killer in women. So thank you for sharing that.
Such increased risks of heart disease, and one of the scariest things that we're seeing is an increase and rise in heart disease among young women. So women less than 55 years old are having one of the biggest increases in heart disease risk. And a lot of that has to do with uncontrolled risk factors. So things like diabetes and obesity, smoking, not living heart healthy lifestyles. These are things that we really need to empower, especially young women, that they need to start making simple changes in their life that can really make a great difference at preventing heart disease later on in their life.
So tell me, you represent the Lehigh Valley Heart Institute, and the Heart Institute is working together with the American Heart Association to help in the prevention of heart disease in our community. Can you explain to me a little how we get to do that together?
Yeah, I think it's really such a tremendous collaboration, and we're so lucky to be able to work together for a shared mission and a shared vision. So at the Lehigh Valley Heart Institute, we have really the region's largest women's heart program. We have 9 female cardiologists who are working very hard and closely with the American Heart Association to really fight heart disease among women in our community. We have many programs within our program. Our Women's Heart program not only tries to reach out to women in our community in general, but we've developed very specific programs in our institute to address some of the more newer and novel risk factors that we've recognized over the past few years that pertain to women. So for instance, our cardio obstetrics program, which was developed 10 years ago, is a very unique program that collaborates between cardiology and OBGYN and maternal fetal medicine. And the goal of that program is to really try to ensure healthy outcomes and healthy pregnancies for women who have heart disease. There are many women who are surviving to childbearing ages from congenital heart diseases and other problems that previously we didn't have the technology and the medical knowledge that these women were surviving to childbearing age. So we have a lot of women with very complex cardiac conditions and a lot of women who've developed acquired heart disease. So high blood pressure, women who've had heart attacks, women who have valve disease. And we have this very unique program where we have taken care of hundreds and hundreds of women to try to make sure that they have the best possible outcome in their pregnancy. And that's just one of several programs that we've developed in our Women's Heart program. Another one is a program that's dedicated to taking care of women with SCAD. SCAD stands for spontaneous coronary artery disease. And SCAD has been recognized in the past several years as being a very important type of a heart attack, in particular that affects women. So it causes heart attacks, oftentimes in young women, and oftentimes in young women who don't have traditional risk factors for heart disease that we would usually think of, like smoking and high cholesterol and diabetes. And this type of a heart attack is something that's been unrecognized for many years and something that requires a very unique type of approach, management, and treatment of this type of heart attack, both in the acute setting and long-term. So we've developed a specific program where we can really try to target these women and give them the best possible care for prevention of future problems down the line, because SCAD is something that can recur. Another program that we have that's very unique is our cardio oncology program. So as we've learned over the past many years, we often talk about heart disease as being the #1 killer of women. Many women think it's breast cancer, but it's heart disease. But the reality is there's a lot of crossover between breast cancer and heart disease, and breast cancer treatments and heart disease. And many breast cancer treatments can actually be a contributor to developing heart disease later in life. So we have a very unique program where we work directly together with oncologists so that we can make sure that we're providing women with the very best care, educating these women about the crossroads between breast cancer treatments, and heart disease to be able to prevent heart disease and try to ensure the very best possible outcomes for them as it relates to their cancer and to their heart disease later on in life. So there's so many things that we've done to really make sure that we are reaching women in our community, that we are really identifying the very specific differences between heart disease in men and heart disease in women, and with a real passion as we collaborate with the American Heart Association, really for prevention, awareness, education, and empowerment of women.
I love hearing you talk about the specifics of these programs, because a lot of people who are watching this today have followed through our events over 2019 and 2020, and we had the pleasure this year of telling 12 different Lehigh Valley community members' stories of heart this year. And a few of those women that we highlighted were actually patients of yours or patients of those programs. And so they were your success stories, listening to someone that has survived, CHD, as you said, and then gone on to be a mother or to have experienced SCAD, and, they were able to tell their stories. And so I think that also is the unique partnership that we have between, you as a doctor with the Heart Institute and myself as an advocate and, community educator through the Heart Association, that we were able to highlight some of those success stories. And so, I encourage people, if they haven't read those stories, that they definitely look them up. And the 12 Stories of Heart were a great exhibit of what the work that you guys are doing at the Heart Institute and how we.
I agree. I think the one of the great areas that we've been able to collaborate with the Heart Institute and the American Heart Association has been through the Go Red movement and the amazing event that the American Heart Association put on last year. Although it was virtual, as you said, the sharing of the 12 stories and these women that have varying ages and varying backgrounds and varying types of heart disease, but really highlights just the diversity of heart disease in our community and the importance of educating patients about heart disease can have many different faces and many different forms. Really empowering and educating women about the symptoms and signs of heart disease. As we know, the symptoms and signs of heart disease can be very different than they are in men. And really recognizing some of the unique risk factors in women, which was, I think, one of the, the great success stories from our virtual Go Red Luncheon, was to really understand that. One other program that I would share with you that we've developed over the past several years, again, it's been a great collaboration with in our Heart Institute and with OBGYN, has been recognition that there are what we call adverse pregnancy outcomes, in particular, high blood pressure in pregnancy, preeclampsia, which is a severe form of high blood pressure in pregnancy, preterm labor. These have been identified over the past several years as being a significant risk factor for development of heart disease. Now, many women are not aware of this. Many women who have these adverse pregnancy outcomes, they get through their pregnancy and they're discharged hopefully with a good outcome and a healthy baby, but they're never educated thereafter that this is a risk factor. And so we have created a program within our Heart Institute where now every single woman who's delivered within our network who has one of these diagnoses developed during their pregnancy, they're being referred to our program so that we can have the opportunity to educate them, so we can have the opportunity to make sure that they are trying to get all of their risk factors at goal and having the appropriate testing, treatment, and management to prevent heart disease from developing. So there's so many new factors that we're learning about in women that are risk factors that we didn't know about previously, like preeclampsia, like certain autoimmune diseases, like stress. Stress as it relates to SCAD and stress as it relates to other forms of heart disease. So there's so much that we're learning about, and together with our collaboration, we really have such an opportunity to reach so many women in our community, especially underserved women in our community. I think one of the other great passions that the Lehigh Valley Heart Institute and the American Heart Association share is really addressing disparities in health. We know that certainly there is disparities between women and men, but there's certainly additional disparities within our communities depending on the underserved populations, and making sure that we really find a way to promote healthy behaviors, healthy lifestyles, and really a good education and awareness for these communities.
I couldn't agree more. So if you had to sum it up and say there's one thing that you wish that women knew about heart disease, what would it be?
I think there are probably two things that I wish. And the first part is something that I think we've made a lot of progress on, but we still have a ways to go. And that is just letting women know that heart disease is the #1 killer of women. Despite all the efforts within our institute, with the American Heart Association, there's still so many women who don't know that very simple fact. So that would be kind of #1. We need to know what our greatest risks are so that we can try to do our best to prevent heart disease. And that's the second part would be, again, that heart disease is preventable. That there is a lot that we can do from a lifestyle standpoint. I spend a lot of time with my patients talking about prevention. Prevention is where it all starts. So talking again about diet, and exercise and stress management and healthy behaviors, really letting women know that those things really truly make a difference in preventing heart disease.
So, Dr. Ahnert, one of the things that we want to do with this Conversations from the Red Couch is we want to enable our community to be able to ask some questions as we have this unique opportunity to have a doctor on our Red Couch. We want to be able to ask you some questions. So some of the most frequently asked questions that came up around your topic and yourself are really how to go about some of those prevention techniques that you speak of. We have a lot of busy women, working moms, women who are struggling every day to just fit in even getting balanced meals into their diet, let alone what it looks like to have that be a healthy balanced meal. Struggling now to be homeschooling their children and trying to do their corporate job in whatever way that they are doing that. Could you give them some advice about how you recommend fitting prevention into a day-to-day schedule?
I think it's such a good question, and it's a question that I get asked so many times a day. And I think what's really important is not just to tell patients, oh, you have to eat healthy, oh, you have to exercise. That doesn't necessarily have meaning. We need to give patients practical advice. And I do that in my practice where I will really spend time with patients and try to understand, number one, where are the barriers for them? So working moms, especially now with virtual education, I'll often say if exercise is really tough for you to get in, do it first thing in the morning. Make it part of your routine, like brushing your teeth, where you're going to wake up and you're going to carve out, even if it's 30 minutes a day. We recommend 30 minutes 5 days a week for exercise in terms of cardiovascular prevention. So do it in the morning, because once the day starts going, we get busy, we get tired, there's homework, you're running kids around, you have your own personal needs. So I think many patients and many women can find that they can be much more successful with exercise if they try to incorporate it first thing in the morning. I think in terms of heart healthy diet, I take a very practical approach with my patients. I think there are many different diet trends and diet fads that are out there, and I take a very common sense approach, which is number one, the more that we can avoid processed foods, the more that we can avoid things that are out of boxes and out of bags, we're going to be healthier. Our bodies weren't made to eat things out of bags and boxes. Increasing the vegetables in your diet and the different types of colors of vegetables in your diet. So trying to really fill your plate with vegetables, you're going to be healthier. Trying to watch your portions and incorporating healthy fats like olive oil, like nuts, like avocado. But it takes a lot of effort and planning. And so when I work with patients, I will try to help them to plan how can they accomplish this. And it really takes thinking ahead. There's so many resources on the internet now that you can just Google and say, quick heart healthy meals or quick healthy meals. And you'll come up with thousands of quick, easy recipes that you can really have for your family. And make it part of the family experience. Talk to your kids about it and talk to your loved ones and friends and family about this recipe that you have and how easy it is and how you can get your vegetables in, and just trying to make different efforts to really be practical about it. And then lastly is telling patients there's no being perfect. Don't strive for perfection. There's going to be days where you're going to be on the run, and it's just unreasonable to think about not grabbing something on the go, but trying to have the healthy things in your home that you can grab on the go, so that you don't fill your pantry with processed snack foods. Have the vegetables already cut up in the refrigerator so that you can grab them and ready to go. Have the meals that you're making, make them in larger quantities so that you can save them and have them for lunch and dinner the next day. So there's a lot of practical things that I think we can try to learn, and by making these small changes, we can really live a healthier life by incorporating, again, the diet and exercise. But there are so many resources on the internet now that I also encourage patients to utilize to really help them for planning. Planning is the key.
I love that. And again, it's something that really is so simple. We just need to take the action behind it. This month has been our digital heart walk experience, and we've been able to share on Wednesdays. We've been doing What You Cookin' Wednesdays with some heart healthy recipes and smart eating choices. And those items are all still housed on our AHA of the Lehigh Valley Facebook page, and through heart.org, which is our website. There is a full dietary needs basically cookbook on there, and many heart healthy recipes. So I encourage people to talk to their doctor. As you said, you utilize that relationship with your physician to figure out what works best for you and to help plan that out. And then, as you said, there are so many resources online that people can use. So
yeah, we have a very time-starved community. I mean, people are time-starved and people are stressed. And I think the most important thing that I would say for women out there, you have to take care of yourself. If you don't take care of your own heart health and make your health a priority, you're not going to be able to take care of all those others around us, because we tend to be the caregivers for our families, and we tend to put our health last. We need to kind of change that way of thinking to know that it's not selfish to take care of yourself. It's not selfish to exercise. It's not selfish to try to make your family eat healthy. It's actually the best thing that you can really do for your family.
And you and I are both mothers of daughters. And so we understand too that it is our job to make them aware, right? Like you said, heart disease is the #1 killer of women. And so we need to lead by example and do what is best for us and then teach them to. So Dr. Ahnert, I thank you so much for being here with us today. This was great. Conversation from the red couch. I wouldn't have chosen anyone else to sit with me other than you. So thank you for your time. The call to action we want to give anyone today is that these frequently asked questions, we do see the value. We want to be able to answer your. So you can email me personally at Abby, abby.silfies, silfies @heart.org. And we will organize those frequently asked questions, and we will be back again in February launching Heart Month and talking with another doc on our red couch. So thank you everyone for joining Dr. Ahnert and I today, and we'll see you again in February.
Thank you for having me, Abby.
Thank you.